Hi, I am Igor. Today we will go talk about subclavian steal syndrome. Definition. Subclavian steal syndrome is a condition in which the subclavian artery proximal to the origin of the vertebral artery narrows or becomes occluded, usually due to atherosclerosis. This blockage results in a lack of blood reaching in the ipsilateral arm through the subclavian artery, which can lead to a reversal blood flow in the affected vertebral artery, so that blood from the contralateral side can flow through the circle of Willis to supply the affected arm. Causes: atherosclerosis most common, narrowing, hardening of arteries due to plaque buildup. Takayasu disease least common, chronic inflammation of the aorta large vessel, giant cell arteritis, Blalock Towson shunt, surgical procedure to increase blood flow to lungs, tube placed between subclavian and pulmonary arteries. Thoracic aortic dissection, thoracic outlet compression, interrupted aortic arch, congenital aortic coarctation. Risk factor: smoking, diabetes, obesity, lack of exercise, and unhealthy diet, family history. More common in individuals who are biological male. Complications include upper limb ischemia and neurological problems. Pathophysiology of this disease: stenosis of the subclavian artery proximal to the origin of the vertebral artery leads to hypoperfusion distal to the stenosis. Reversal blood flow in ipsilateral vertebral artery leads to compression through the collateral arteries and reduced blood flow in the basal artery, and reduced cerebral perfusion upon exertion involves the affected arm. Clinical feature: asymptomatic, may be asymptomatic, and symptomatic include numbness of arm, extends to fingertips most frequent, vertebral-basal artery insufficiency, which include presyncope, syncope, and neurological deficits, upper extremity claudication, tingling sensation and numbness in face, decreased blood pressure of the affected site, transient hemiparesis, weakness of the affected site, blood pressure in left arm less than blood pressure in right arm, pulse in left arm less than pulse in right arm. And we see cyanosis of the left arm in patient with left subclavian steal syndrome compared to the right arm. And diagnosis. Diagnosis includes CT angiography and Doppler ultrasound scan. Treatment is in a symptomatic patient usually do not require treatment apart from lifestyle changes to prevent progression of atherosclerosis. Symptomatic patient: angioplasty and stenting or surgical revascularization. Subscribe to the channel. Thank you.